see a lot of people not tightening that down. It's just screw it down real good. And then you've got your tape.
It should be prepared ahead of time.
Should be ready for you. And my advice is to tape right over it in this kind of a situation.
We do have...
I actually would back it over this direction, loop it back. And again, this IV is not going to run if he's bending his arm, because you'd see that's in the bend of the arm, and he could clamp that off. So you can see, hang on a second, let me get a little air in the chamber you can watch. And there's a little tiny little bubble there. Again, not a big deal. This is all venous. So you can see how the IV runs. And if I will open it wide open, it runs fabulous wide open. If I need it in, I'm going to squeeze it real hard. The higher I raise it, the faster the fluid's going to run in. I'm going to go ahead and roll it off. He doesn't need fluid.
You're not thirsty now, are you?
I asked that guy that claps back there if he was nauseated. Nausea is also a sign of low blood pressure. Pale, if he's sick, feeling like he's going to vomit.
What do you say?
He said he was nauseated.
Oh, he was?
Yeah.
Did you determine that it
Was
was
he
a diabetic
dehydrated?
seizure?
He's not diabetic.
He was dehydrated. Was he dehydrated?
He probably was, yeah, he was sound like it was a viral syndrome. Your veins get bigger, your blood pools, you're not going to tolerate sitting up. He said he was feeling sick this morning. Where'd that back over to us? So I'm all done. Again, or if I missed, I would, and if I blew the vein, you just see a swelling around that area. And I do that every day. I mean, some people are hard to start veins on, and I chose a real easy vein. It was basically cheating. I mean, anybody that's a half-a-year nurse could probably get that vein.
By blowing the vein, you've gone through it, the vein
You've gone through the side.
And the liquid is going into the tissue.
Exactly, you're bleeding into the tissues. And they're going to get a little bruise there, but that's what it is to...
If you're coherent when they miss, you'll be able to tell.
If you pass through the skin time and miss the vein, do you start a new catheter? Or will you
If
go
you've
through
come
the skin?
out of the skin all the way with your needle, yeah, you need to ditch that one and get a brand new needle.
Make sure everybody knows that.
Did you guys all hear that? If I've missed the needle, if I've missed my vein, if I've withdrawn it all the way out of the skin, you don't re-enter with the same needle. That's why if I've missed the vein, I'm going to back up slowly, and I'm going to re-angle my needle, and I'm going to go towards that. And again, I've got good traction. If this is a hand vein, I've got good traction. If I've missed, it's not going in yet, I might re-angle. I think I'll go in that way. And people hate that, but do you hate it worse than me poking you again in another spot? Is there something I can get there? And honestly, you're in the hospital for a reason. Don't expect it to be a fabulous experience. They're there to have something done. It's invasive. You're not there to suck on candy.
Inject morphine first.
You can't inject morphine without this, unless you're going to give it rectally or a pill form, and you're not going to get any morphine for an IV start, nor would you want to.
The important principle he's trying to communicate is you never go through the skin twice with the same needle because of contamination.
You could potentially get an infection.
You're dressed like you work in the ER or something.
You? Yeah, smoke tech, nice. So again, pressure, and the patient should hold pressure there a good 2 minutes if they have normal clotting factors. If there aren't any heparin, Coumadin, then they should hold it for 5 to 10 minutes. And the lab tech's not going to sit there after they've poked them for 5 or 10 minutes. They have who knows how many lab draws, and they take off. They'll say, yeah, go ahead and hold that there, I gotta go.
Yeah.
And honestly, I think it's better to keep that open and hold that pressure, because you've got tissues there, you can hold it. You start doing that, and you've kind of buried that vein deeper into the arm, and so it's more apt to bleed, in my opinion. But a lot of people do that, and you know, it's not the end of the world, but